or as a patient, why you're feeling what you're feeling, okay? Mm-hmm. Now, do you remember what you're feeling now? Mm-hmm. Okay, because what we're going to do here, you can let go, and now we're going to reach across, and you're going to do that same thing to me. Mm-hmm. I'm going to do the same thing to you. Mm-hmm. But there's a difference here because I don't know what you did to yourself. Mm-hmm. I don't know how hard you pulled and what, literally the direction, etc. Mm-hmm. So let's just reach across, and you can come. Good. Mm-hmm. We're going to put them on each other's faces, and now do what you did to yourself to me, mm-hmm. and I'm going to do this to you here. I've had my pterygoids manipulated, where someone goes in there and cranks on it. And I say crank on it because to me it felt super aggressive, super assertive, too much. Other people really crave that kind of deep input. I don't, but other people do. I'm willing to negotiate with them. I'm not going to go in there and crank on the inside of their mouth, but I will give them more pressure. If that's what they feel they want, they value, and they expect, and what they think is necessary to create change. What happens if you play with side bend or rotation? What happens if you move from you trying all those movements to asking your patient, help me help you? Where do we need to take your head and neck to find a feeling, replicate a sensation, go to a range of motion that you find useful? If Melissa felt that this tightness in through here was impacting why she was in to see me, we're going to address it accordingly. And a couple ways that I like to do that is a simple way of sitting here at the head of the table and engaging in this fashion. Drag it up and over, much like water flowing over a waterfalls. And what plane do I go in, what direction I go in, is what Melissa and I determine through feedback, okay? Because what I want to do is not just perform a stretch. I want to do an engagement that Melissa says, ooh, right there. That's some of that pain, numbness, breathing issue, whatever it is we're doing and why we're doing it. That's what we're looking for here. Now, did you see Melissa's pelvis go from a more anterior position into a posterior position? She had a bit of a lumbar curve that flattened out when I gave her that traction. Biomechanical models of tissue-based problems often talk about the change in spatial orientation of the psoas, et cetera, like that. And while there could be some truth to that, there is something, though, that for a lot of people, this sort of stretch feels really useful, really good. They wish they could do this up by themselves at home. I'm going to try and begin to connect with almost an infinite number of directions, an infinite number of planes, until we find something that Melissa finds useful, whether it's right here in the thigh or spiraling up through the gluteal region, through the lumbosacral region. And often the spiral will take us often into the opposite side of that thoracolumbar region. We're looking to connect with something that Melissa feels is useful.